The Burn Unit Ghost, a medical drama script. Act 1. The Ghost in the Gloves. The smell of a burn unit is not like anything else in a hospital, not the sharp antiseptic bite of a standard ER, nor the cold metallic tang of a trauma bay. It is something older and more brutal, the smell of cooked protein and chemical accelerant, and the particular sweetness of damaged skin trying desperately to knit itself back together. It clings to the walls, soaks into the ceiling tiles, lives in the air filters and refuses to be cleaned out. Elena Vasquez had stopped noticing the smell on her third day. That had been 4 years ago. She moved through the burn unit of Harborview Medical Center in Seattle with an absolute and quiet certainty of direction. 38 years old, though most staff placed her closer to 45, a miscalculation born not from her face but from the quality of stillness she carried. The stillness of someone who had learned, at considerable cost, that panic is a luxury, and noise is almost always wasted energy. Navy blue nursing scrubs, dark hair in a tight braid, no jewelry, hospital ID badge clipped to her left breast pocket. And she wore gloves. Not the standard purple nitrile gloves the rest of the staff pulled on and snapped off 100 times a shift. Elena's were different. Thin, flesh-toned compression material, custom-fitted, extending from her fingertips to just below her wrists. Always on, morning rounds, medication passes, dressing changes, lunch. Always on, always. In 4 years at Harborview's burn unit, no one had ever seen Elena Vasquez's bare hands. The staff had theories. Nurse Danny Okafor, 11 years in the unit and its unofficial social historian, maintained the leading one. Severe eczema, a cruel self-reinforcing loop, with the glove wearing itself. Second-year resident Dr. Marcus Webb believed Elena had been burned at some point. The gloves were therapy and armor both. She doesn't flinch on the 90% TBSA cases, Webb told the other residents. The break room door pulled almost but not quite shut. That's not training, that's recognition. Webb was closer to the truth than he knew, though not in the way he imagined. The only person who had never speculated was Dr. Raymond Choi, director of Harborview's Burn Treatment Center. Choi did not speculate about subordinates. He categorized them. Elena had been categorized on her first day, when she corrected his debridement technique on a pediatric case with such precise anatomical knowledge that he stopped mid-procedure and stared for 3 full seconds. The correction was accurate. The technique adjustment reduced the child's healing time by 11 days. He filed her under competent. Possibly overqualified, troublingly opaque. Watch. 4 years later, the file had not been updated, because Choi had decided that anything he could not fully understand was slightly threatening, and the appropriate response to threats was containment. He contained Elena Vasquez through paperwork. She was assigned the most documentation-heavy cases, thickest charts, most complex wound mapping requirements, longest family communication logs. While other nurses performed the hands-on interventions that were the actual work of the unit, Elena was frequently at the documentation desk. She never complained about any of it. This, too, bothered Choi deeply. On the morning that would end up changing everything, Elena arrived at 06:30 as she always did, 30 minutes early. Room 4, Gerald, 41, a construction worker who had caught a flash explosion from a ruptured gas line 3 days prior. Partial thickness burns to his forearms and right neck. In pain and frightened and expressing both by being aggressively unpleasant to everyone who entered. You again, Gerald said when Elena pushed the door open, arms held slightly away from his body in the posture of someone for whom even air pressure causes discomfort. Where's the one with the red hair? East corridor this morning, Elena said, moving to the supply cart. How was your night? I feel like someone held a lighter to my arms for an hour. That's actually a fairly accurate physiological description, Elena said. She checked the overnight dressing notes, her gloved finger tracing the wound mapping diagram. Nerve endings in partial thickness burns remain intact and active. Your nervous system is doing exactly what it's supposed to do. Gerald stared at her. Is that supposed to make me feel better? No, it's supposed to make you feel informed. Those are different things. She worked in near silence after that, unwrapping and rewrapping with a precision that made the process look choreographed. Her efficiency had a different texture from the efficiency of the other nurses. Not the efficiency of long repetition, but of someone who had learned to do this in conditions where any wasted motion had consequences she did not permit herself to think about anymore. Gerald made 3 sounds of pain and said nothing else. The incident with Dr. Choi happened later that morning in the medication room. She was pulling evening analgesic doses when Choi pushed the door open, the confidence of a man who has never once knocked. Behind him, Patricia Holt, Deputy Director of Clinical Operations, Navy suit, administration badge. We've been reviewing staffing efficiency metrics, Holt said. Dr. Choi and I are discussing restructuring of role responsibilities. Specifically, Choi said, examining a medication label without looking at Elena. Whether your skill set is best deployed at the clinical level. Your documented intervention record shows significant time in administrative functions. There it was, structured as a question, not an attack. My record shows administrative time because I've been assigned to documentation for 7 months, Elena said. Which reflects the judgment of unit leadership, Choi said. I want to run a clinical skills evaluation over the next 2 weeks, Choi continued. If the results support full floor reassignment, we'll proceed. If not, we'll discuss whether your skill set belongs in a different role. He said it like he was being generous. Patricia Holt's expression was carefully neutral, but Elena caught the very slight discomfort in it. Filed away. I'll participate in any evaluation the unit requires, Elena said. Dr. Choi, she added, as he turned to leave. He stopped. Room 7, Hendricks. His wound mapping this morning shows extension of the full thickness injury into the right axillary fold, not captured in yesterday's chart. The grafting plan is based on incomplete assessment. You'll want to revise before the scheduled procedure tomorrow. A long silence. I'll review the chart. I updated it an hour ago with revised mapping and supporting photos, Elena said, and turned back to the medication tray. That night, alone in her apartment, Elena sat at her kitchen table and removed her compression gloves. Her hands were not burned in the straightforward sense. They were scarred, dense, layered, irregular scarring from deep traumatic lacerations, multiple and overlapping, repaired under field conditions with sutures more interested in saving the hands than in cosmetic outcome. On the right palm, a long burn scar ran diagonally from thumb base to little finger, the trace of something searing gripped by choice rather than by accident. She looked at them for a long time, then she put the gloves back on and went to bed. Act 2. The heat builds. The competency evaluation began on Monday, assigned to Dr. Marcus Webb. Webb arrived with a clipboard and the expression of a man given a task he finds both distasteful and professionally valuable. Standard competency domains, he told Elena before rounds: medication management, wound assessment, critical intervention response, 2 weeks, direct observation and chart review. I'll cooperate fully, Elena said. Ask me anything you need. What Webb found confused him deeply. The medication management was flawless. Her wound assessments were predictive in a way that didn't fit the framework he'd built around her. 3 times in the first week, she identified deteriorating conditions in patients whose charts showed stability, escalating interventions that in each case proved exactly right. How did you catch the pH shift in the Henderson case before the blood work came back? He asked on Thursday. Respiratory rate increased by 3 breaths per minute over 4 hours. Slight yellowish undertone around the graft margins. Wound exudate moisture content changed. She paused. Together, they suggested metabolic acidosis developing faster than the monitoring schedule would catch. Webb stared at her. 6 separate clinical indicators. On 17 patients. Yes. He wrote something on his clipboard. His pen moved for a long time. In the second week, Danny made her position clear in the break room at a volume the hallway could hear. She caught the Henderson metabolic thing before any monitor in this unit. If you write this evaluation without noting that her numbers look low because Choi buried her in paperwork, you're not doing an evaluation. You're doing what Choi wants. Webb said nothing. He left and sat with the evaluation for a long time. On the final day of the evaluation period, something happened that changed the weight of every calculation. It was 1400 hours, the post-lunch lull that was, paradoxically, the most dangerous time on a burn unit, when monitoring intensity naturally dropped and circadian rhythms fought against the demands of the shift. Elena was at the documentation desk when the alarm sounded from Room 9. Room 9, Arthur Desai, 67 years old, admitted 6 days prior with chemical burns to his torso and upper extremities. Progressing within expected parameters. Chart showing nothing alarming as of this morning. Elena was moving before the alarm completed its first cycle. She pushed into Room 9 and saw immediately Arthur was in respiratory distress, his chest moving with the shallow, inefficient labor of someone whose airway was compromising. His skin color was wrong, his lips were wrong, his fingertips were wrong. Inhalation injury complication, Elena said, to no one and everyone, her voice carrying the flat, compelling quality of a combat command. Not loud, but structured to penetrate. She reached for the call button. I need respiratory here now. Get me a nasopharyngoscope and a size 7 ETT, and page whoever's covering. She was at Arthur's head, tilting his jaw, repositioning his airway manually. She felt, through the compression gloves, through the outer sterile gloves she'd pulled on in the 3 steps between the desk and the bed, the structural status of his airway, with a sensitivity that should have been impossible through that much material. Webb arrived at a run, the respiratory therapist behind him. Subglottic edema, Elena said without turning. Rapid onset. He has maybe 4 minutes before the window closes. She held out her hand. Scope. Webb handed it to her. He did not question it. Later he would not be entirely sure why not, whether it was the authority in her posture, or the precision of her assessment, or simply the speed of everything and the fact that hesitation would cost Arthur his airway. She intubated Arthur Desai in under 90 seconds. In a conscious patient with a compromising airway and escalating edema, she did it with the same quality of movement she brought to everything, not performatively fast, but with a total absence of wasted motion, the economy of someone for whom this was not a procedure, but a reflexive act. Arthur's oxygen saturation climbed from 78 back through 85 and into the 90s within 2 minutes of successful tube placement. The room was very quiet when it was done. Webb looked at Elena. She was documenting the procedure, her gloved hands moving across the chart. Her heart rate, as far as anyone could tell, had not changed. That was a surgical airway complication, Webb said. That's not. It was a clinical emergency, Elena said. It required an intervention. She didn't look up. Please make sure respiratory keeps him at the current FiO2 and reassesses in 30. Webb's evaluation landed 4 days later. Choi read it in 12 minutes, then appeared at Elena's workstation. Inconclusive, Choi said. What does Webb conclude? Above standard clinical competencies, full floor reinstatement, senior nursing classification. He set the printout down. Exceptional performance under observation, doesn't address the pattern that led to the evaluation. He straightened his coat. I want a unit without ambiguity about role boundaries. Your performance creates ambiguity. His eyes moved to her gloves. Your presentation creates ambiguity. Patients ask, staff speculates. My hands are a medical matter, Elena said. They're a presentation matter. Dr. Choi, quiet and level, and the resident at the next workstation very carefully looked at his screen. My hands have never interfered with my ability to provide care. If you believe they have, document a specific clinical incident. If you cannot, this conversation is about something other than patient safety. Long silence. I'm adding you to the weekend overnight rotation, Choi said. Not a clinical decision, a message. Elena turned back to the wound maps and continued updating. Act 3. When the sky catches fire. The call came in on a Saturday. Elena was 22 hours into the weekend stretch Choi had assigned when the mass casualty alert hit the system at 03:47. The Cascade Industrial Fire, a chemical storage facility 40 minutes north of Seattle, processing marine coatings and solvents. 3 structures fully involved. A wind shift had carried burning solvent vapor across an access road where vehicles had staged. 40+ casualties, severe burns, inhalation injuries. Harborview, as Seattle's premier burn center, was taking the critical cases. Elena was at the nursing station when the alert came through. She closed the chart she was updating. She stood up. Danny, she said to Nurse Okafor, finishing a medication pass. Mass casualty incoming. Cascade Industrial. Burn and inhalation. Start clearing the post-acute rooms on the east corridor for conversion to acute intake. Move the Mitchell girl first, she's the most stable, and get me an inventory of available debridement supplies. How many incoming? First estimate is 12 to us. That number will go up. Elena was already at the supply room. Page overnight coverage and tell them I need bodies. And call Dr. Webb, he lives closer than Choi. Choi's going to want to be called first. Call Webb first, Elena said. She did not elaborate. The next 40 minutes were controlled chaos. Elena organized it with the focused efficiency of someone who has done this, specifically this, first triage of mass burn casualties, many times before. By 04:28, when the first ambulances arrived, the burn unit had 8 rooms reconfigured, full supply inventory completed, respiratory teams standing by, specialized equipment staged in the corridor. The patients came in fast and hard. Elena moved through the bay, assessed, directed, intervened when needed, stepped back when not. Marcus Webb arrived at 04:41 in civilian clothes and a white coat thrown over everything. He took one look at the organized triage and then at Elena. He put on his gloves and went to work without a word. By 0600, 11 patients in the unit. 10 stabilized. 1. A 44-year-old with 90% TBSA burns and respiratory compromise that had progressed during transport. Critical and deteriorating. Dr. Choi arrived at 0612. He took in the reconfigured unit, the organized documentation, the stabilized patients. His burn unit had absorbed 11 mass casualty patients overnight without losing one. His expression moved through stages. Surprise, then the recalibration of a man assessing how to respond to a success he did not orchestrate. I understand you initiated a unit restructuring without administrative approval, he said. I initiated a mass casualty response within my clinical authority, Elena said, not turning from the critical patient's bedside. Supplies within inventory. Room conversions within protocol. 11 critical patients, 0 losses. You live 38 minutes from the hospital. Webb lives 12. They worked together for the next 2 hours without further discussion. Choi was, whatever else he was, an excellent physician. They traded the space between them with the efficiency of people too busy for anything else. At 0847, the critical patient stabilized. Choi looked at Elena across the bed. The intubation on Desai last week, he said. I read the procedure note. That's not a standard nursing competency. Elena said nothing. Where did you train? He asked. Before she could respond, before she had determined what she would say, the sound started. Subtle at first, a vibration in the window glass, a tremor in the overhead lights, a frequency entering the building not through air but through structure itself, walls, floors, bed frames picking it up before the human ear could fully classify it. Elena's hands stilled. She knew that sound. Her nervous system classified it before her conscious mind did. The body remembered before the brain caught up. Her pulse jumped, not with fear but with something more complicated. Recognition. The particular physiological response to hearing your native language spoken after years of living in translation. Rotor blades. Not the high, urgent whine of a civilian life flight helicopter, not the light chop of a news chopper. This was the deep, rhythmic, heavy percussion of multiple large-frame military rotorcraft, the sound of machines that displace serious amounts of air and are not concerned with whether you find the noise inconvenient. What is that? Danny said from the corridor. Elena took a breath. She set down the assessment tool in her hand. She placed it on the tray with the careful deliberation of someone buying themselves one additional moment. I don't know, she said. It was the first direct lie she had told in 4 years. Act 4. The hands that held the line. The Coast Guard HH-60 Jayhawks came in from the northwest, 4 of them, in a modified tactical formation that had no business appearing over a civilian hospital in Seattle on a Saturday morning. Not the bright orange rescue helicopters of television familiarity, darker configured operational variants that descended on Harborview's parking structure with the certainty of machines operated by people who have determined their destination and do not anticipate being redirected. The downwash hit the hospital like a horizontal weather event. Windows rattled. Car alarms triggered. A maintenance worker on the roof grabbed a ventilation housing to stay upright. In the burn unit, everyone stopped. The men who emerged were Coast Guard rescue swimmers and tactical medical personnel in operational gear, dry suits, helmets, equipment vests, carrying 2 litters. On the litters, Coast Guard personnel caught when a burning storage tank ruptured and sent a wave of burning solvent across the access canal where their response team had staged. Behind the tactical personnel walked a man. Mid-50s, broad-shouldered, close-cropped grey hair, a face that suggested geological process rather than aging, the dress uniform of the United States Coast Guard, formal blues, gold braid, the constellation of ribbons and decorations that told, for those who could read the language, a long story in difficult places. On his collar, the insignia of a Vice Admiral. Vice Admiral James Calloway, Commander, Coast Guard Pacific Area, walking directly toward the burn unit. Choi moved toward the main entry. This is a burn unit. If these are cascade response casualties, they need to go through emergency triage. We did, said the rescue swimmer who came through the door first. Enormous and extremely calm, in the way of people who have pulled drowning human beings from cold water and found most other things manageable by comparison. We cleared triage 14 minutes ago. They're burn and inhalation. We need the burn unit. These patients need to be assessed before. They've been assessed, the swimmer said, by us. Then Vice Admiral Calloway walked through the door. The effect of a senior military officer in full-dress uniform entering a hospital room is difficult to describe. Not simply the visual impact of the uniform. Something more atmospheric, the way a space reorganizes itself around a certain kind of authority. Staff in motion slowed. Conversations stopped. Choi recalibrated rapidly. Admiral, I'm Dr. Raymond Choi, Director of the Burn Treatment Center. I want to assure you your personnel will receive every... I'm sure they will, Calloway said, his voice baritone and composed. He was looking past Choi, his eyes moving through the unit with the systematic efficiency of a search. I need to speak with a member of your staff. Of course, whoever you. Elena Vasquez, Calloway said. The name landed in the unit like a stone dropped in still water. Danny Okafor's head came up from the chart she was updating. Webb, assessing a patient in the adjacent room, stopped moving. 3 nurses at the station turned simultaneously toward the sound. At the far end of the unit, standing at the bedside of the now stable critical patient she had managed since 0347, Elena Vasquez went very still. She did not turn around immediately. She stood with her back to the room for 3 full seconds, her gloved hands resting on the bed rail, her head slightly bowed. She appeared, to anyone watching, to be checking the patient's condition. She was not. She was standing inside the last 3 seconds of a life she had carefully constructed and maintained for 4 years, feeling it shift beneath her like ground before a landslide. Then she straightened. She turned around. Calloway saw her immediately. His eyes found her across the length of the unit with the targeted speed of someone looking for something specific. And something happened in his face, a brief, involuntary movement that cannot be prepared for or controlled, belonging to the category of responses that precede thought. It was relief, profound and uncomplicated relief. He walked the length of the unit toward her. Nobody spoke. Nobody moved. The unit had the quality of held breath. Calloway stopped 2 feet from Elena. He looked at her. She looked back. Her face carried the professional neutrality she had learned to use as both armor and camouflage. But around her eyes, something was happening that the neutral expression could not quite cover. "Chief," Calloway said. The word fell into the silence like a key turning in a lock. "Admiral," Elena said. Her voice was level, the voice of someone holding a great deal of weight with long practice. "You changed your name," Calloway said. "Legally." "Vasquez, your mother's name, yes. We've been looking for you for 2 years," he said, "since the medical separation." "I know," Elena said. "You knew we were looking. I knew you would look." "Yes." A beat. "You didn't want to be found," he said. "No." Calloway looked at her hands, the gloves, and something crossed his expression that was not the curiosity of the staff or the discomfort of administration. It was something that looked like knowledge and grief and an old guilt that had not resolved. "How are they?" he asked. Elena looked down at her gloved hands. "Functional," she said. 91% grip strength on the right, 87 on the left. Fine motor is intact. "You can still operate," he said. It was not a question. "I can function as a nurse," Elena said carefully. "Elena," he used her actual name, and the careful distance she had maintained for 4 years flickered. "I watched you run a 12-patient mass casualty intake while your unit director was asleep. I have 2 of my rescue swimmers on your litters right now whose field assessment notes from the scene read like they were written by a level 1 trauma surgeon." He paused. "You did that over comms while managing your unit." In the corridor behind Calloway, Choi had gone very still. Webb had emerged from the patient room. The entire visible staff of the unit was watching. "I provided remote guidance," Elena said. "They're excellent personnel. They're alive because of what you told them to do," Calloway said, at 0:30, on a weekend, after what appears to have been a 22-hour shift in a unit where your director had you filing paperwork for 7 months. The last sentence came out with a quality that was not loud and was not calm. The controlled edge of a very senior officer who has arrived at a scene, completed his assessment, and found the situation in significant violation of standards he takes personally. He reached into the breast pocket of his dress uniform and produced a small, dark document wallet, official, sealed. "I'm not here informally," he said. "The Commandant of the Coast Guard asked me to deliver this personally. It required locating you first." Elena took it with her gloved hands. She opened it. Inside, a letter on Commandant stationery, a formal document bearing the seal of the Department of Homeland Security, and beneath those, a smaller card, official, embossed, that Elena read once, then held still for a long moment. Danny Okafor could not read the card from 3 beds away, but she watched Elena's face, which she had spent 4 years studying, and she saw something happen in it that she had never seen happen before. The containment fractured, not dramatically, not in the way of someone breaking down, in the way of a structure settling under a weight that is not collapse but resolution, the particular release of something held in tension for a very long time. Elena's eyes closed for 3 seconds, then opened. "This is a reinstatement order," she said quietly. "Senior Medical Officer classification," Calloway confirmed. "With specialty designation, the board reviewed your separation documentation. They reviewed the Cascade response from last year, the maritime one, where your remote triage guidance saved the Kittitas crew. And they reviewed what you did the night of the Bering Sea incident. The unit was so quiet that the ventilators were clearly audible. I don't want reinstatement, Elena said. The words were steady and genuine, and without self-pity. I separated because I needed. I know what you needed, Calloway said. His voice had dropped the official quality. Something more human replaced it. I know why you left. I know what the Bering Sea cost you. His eyes moved again to her gloves. I know what you did after. A long pause. We are not asking you to go back to what you were, Calloway said. The program we're proposing is a civilian military medical liaison role. Pacific area. You live here, work here, or wherever you choose. When we need you, when our people need you, you're accessible. You advise, you train, you respond to situations like tonight. He let that settle. No combat deployments, no field rotations, no more of this. He meant the unit, the gloves, the paperwork. 4 years of extraordinary competence quietly buried. That's the offer, he said. And the commandant authorized me to add one element that should have been addressed 3 years ago and was delayed by circumstances that do not reflect well on the process, or on me personally. He turned to his aide, who stepped forward with a narrow presentation case. Calloway opened it. On dark blue velvet, on the gold bar of a service ribbon, rested the Coast Guard Medal, the service's highest non-combat honor, alongside a second ribbon Elena recognized with a sharp intake of breath, the Meritorious Service Medal, with a device indicating a specific operational citation. For the Bering Sea incident, Calloway said. You held that platform for 19 hours, operated on 11 personnel under conditions that don't translate to language. When rescue assets reached you, 3 of those 11 were ambulatory. You were not. You refused medical evacuation twice. We had to order you. You continued to provide care during the evacuation flight. A pause. The delay in recognition was bureaucratic and indefensible, and I am personally sorry for it. The presentation case rested between them. Elena looked at the medals. She looked at Calloway. She looked around the unit, at Danny Okafor, hand pressed flat against her mouth. At Marcus Webb, standing in the patient room doorway with an expression suggesting he was rapidly reassembling his understanding of several things. At the patients in their beds, the carefully updated wound maps, the stabilized monitors, 11 lives that had moved through this unit tonight and arrived on the other side. She looked at Dr. Raymond Choi, standing by the unit entrance, with the expression of a man in whom several significant recalibrations were occurring simultaneously. About the competency evaluation, about 7 months of documentation assignments, about what it means to manage someone you cannot fully assess and choose containment as your primary tool. Choi held her gaze. He did not look away. Elena turned back to Calloway. She looked at the medals. She looked at her gloved hands holding the reinstatement letter. Then she set the letter carefully on the patient's bedside table. She took off her outer sterile gloves and laid them aside, and then, slowly, without drama, without performance, she removed her compression gloves. She placed them on the bed rail. Her hands were bare for the first time in 4 years. The scars caught the clinical light and held it. The dense, layered, irregular scarring of deep traumatic lacerations, multiple and overlapping, repaired under field conditions by sutures more interested in saving the hands than in cosmetic outcome. The long diagonal burn scar across the right palm, the unmistakable trace of something searing having been gripped by choice rather than by accident. They were not beautiful hands. They were not destroyed hands. They were hands that had been broken and rebuilt and returned to full function through a process nobody in this unit had known about. Danny Okafor made a sound that was not quite a word. Webb pressed his hand against the door frame as though he needed the support. Elena turned her hands over, palms up, then back, in the gesture of someone examining a tool. Then she looked up at Calloway. The reinstatement includes the liaison role, she said. Yes. I choose my cases. Within reason. I keep working in this unit. Calloway looked at Choi. The look had a quality that made the burn unit director take a very slight step backward. That will be arranged, Calloway said. Elena picked up the presentation case with her bare hands. She held the weight of it for a moment. Then she set it down beside the reinstatement letter. She turned to Danny Okafor. The 2 incoming patients from the litters need assessment, Elena said. Her voice was the same voice it always was. Steady, direct, stripped of everything unnecessary. Her respiratory first, then wound mapping. I'll take the one on the right. Danny stared at her bare hands for 1 more second. Yeah, Danny said, her voice slightly unsteady. Yeah, okay. Elena moved toward the incoming patients. Behind her, Vice Admiral Calloway watched her go. He watched the unit reorganize itself around her, the way it always had, though no one had understood why. Not because she demanded it, because she was what she was, and rooms respond to that whether they know it or not. He turned to Choi. The reinstatement paperwork will formalize the civilian liaison role, Calloway said quietly. I understand there was an ongoing competency evaluation. I'd recommend closing it. The outcome is not in question. Choi looked at the Vice Admiral. He looked at Elena, moving with her bare scarred hands through the burn unit she had run through the darkest hours of the night, doing the work she had always been capable of doing. Yes, Choi said. I'll close it. The burn unit continued its work. The morning light came through the windows. The monitors maintained their steady rhythms. the hands that had held the line, through the Bering Sea and the burn unit corridor, and the 19 documented hours that no one here had known about until now, moved through the work that had always been the point of everything. Not the medals, not the rank, not the reinstatement. The patient in front of her, the next breath drawn, the margin between survival and its opposite, held open by skill and will and the particular refusal to stop. Epilogue. 3 weeks later, a new badge appeared at the Harborview Burn Unit nursing station. It was clipped at the end of shift on a Tuesday, next to a patient assessment report completed with the kind of systematic precision that still made Marcus Webb stop and reread it when he thought no one was looking. The badge showed Elena's photograph, the same composed, neutral expression as the one it replaced. The name was the same, the unit designation was the same, but in the classification field, beneath the nursing credentials, 2 additional lines had been added. EACG Medical Liaison Officer, Pacific Area. Senior Trauma Specialist, Operational Designation. Danny Okafor found it first. She read it twice, picked up her coffee, walked to the window, and looked out at the city for a full minute. Then she turned around and went back to work. Down the corridor, Elena was at Gerald's room. Gerald, who had been discharged 2 weeks ago and had come back, which patients rarely do, to say thank you. He stood in the doorway in his street clothes, his healed forearms bearing the slight discoloration of resolved partial thickness burns. He looked at her bare hands. He didn't ask about the scars. He had been through enough himself to know that scars are not questions, they are answers. "You look different," he said. Elena looked down at her hands. She turned them over once. "Yes," she said, "I suppose I do." She sent him home. She updated his discharge record. She moved to the next room. There was always a patient who needed her. She was exactly where she belonged. If Elena's story, of quiet sacrifice, hidden strength, and the impossible grace of those who give everything without asking to be seen, stayed with you, hit that like button now. Share this video with someone who needs a reminder that the most extraordinary people are often the quietest ones in the room. Subscribe for more stories of the real heroes among us, the ones whose greatest battles are never announced and whose courage costs more than we know. Drop a comment below. When did you last underestimate someone who turned out to be extraordinary?